1440 KVON 99.3 The Vine. This is Kelly. It is time for Healthy Communities with St. Helena Hospital. And I'm delighted to have a new guest with me. She's never been here before, so I'm excited about that. Dr. Diane Hambrick is with us from the St. Helena Recovery Center. Good morning.
Good morning.
So nice to have you here.
Thank you.
Dr. Hambrick, tell us a little bit about your background.
I am a physician practicing at St. Helena Hospital. I'm what's called an addiction medicine specialist. That's all that I do. I'm not a psychiatrist. I'm a family practice doctor specializing in alcohol and drug treatment. I've been doing it about 40 years. I'm just
40
old.
years? Oh, no, you're not. And you're beautiful. So I have to ask, what led you to go into this field?
Well, I started out in my medical career in family practice. My father was a physician, and I was kind of following in his footsteps. And in fact, we did practice together for a while in San Francisco. And, I think that most people think that they choose their careers. I think our careers choose us. I had no interest in this field. In fact, this field didn't exist when I was starting out in practice. And I like to say, while I was doing family medicine, addicts just kept showing up on my doorstep.
Really?
And I thought, well, this is very interesting. I don't have a clue as to what to do for them. And they kept coming back and kept coming back, and I found out that I wasn't afraid to talk to them. I was interested in their lives, and over time it's developed into my career, and I'm very happy with it.
And so much has changed in this field.
Absolutely. All of the treatment used to be anecdotal. Make it up as you go along. Try this and see if it works. And now there's a whole body of science around the treatment of people with addictions. So it's very formalized now. There are residencies and fellowship programs for physicians to learn how to treat the disease of addiction.
And that's just calling it a disease is not all that old. I mean, wasn't it before? Just stop drinking.
Exactly.
You're making a bad choice.
Exactly. It was thought to be a matter of weak will, or in some sectors even, sinful behavior.
Right.
And now we recognize that it's a brain disease. It's a mind, body, heart, soul, spirit illness, like all illnesses are.
Well, let's talk about that a little bit. What is the definition of addiction?
People have so many thoughts from personal experience or the movies or the media as to what addiction is. And I'm able to really hone it down and give a concise kind of definition. And basically it has 4 parts. The first part is the compulsion to drink or use or do the behavior. And by the way, we're talking about cigarette smoking, we're talking about overeating, we're talking about gambling, shopping, as well as chemical dependency, as well as prescription medication abuse. So nobody's really exempt. If you just can't do without chocolate eclairs, and it's put 20 pounds on you, and your doctor has said you really need to lose that 20 pounds, and you really have a hard time doing that because you can't give up your chocolate eclairs, you've got a problem.
That's an addiction.
Right. That's right. Okay. So the 4 parts are essentially, number 1 is the compulsion to drink or use or do the behavior. And in my mind, that means how much space it takes up in your brain. If you have a headache and you think, gosh, I've got a headache, I think I'll take an aspirin. And you take the aspirin, that didn't take up very much space in your brain. But if you're deciding whether or not to take that drink, I'm really thirsty and it's the end of the day and I'm really tired and I really could use a cocktail. But, my spouse said, honey, every time you drink, you start acting strange and the kids don't want to be around you. But, I've earned this drink. I've worked really hard today and a drink will be okay. I give myself permission to do that. Look how much space it's taking up in your brain. Okay? So that's the compulsion to drink or use or do the behavior. The second part is loss of control. Loss of control over when you start, but also loss of control over when you stop. And everybody knows the expression, boy, when that guy starts drinking, he just can't stop. So one is not enough, and it just escalates on itself. But it also has to do with loss of control over when you start to drink or use or do the behavior.
Oh, okay.
And that has to do with things that trigger us.
Okay.
You know? It's 5 o'clock. It's cocktail hour. It can't be 5 o'clock and I not drink. The hour is a
Okay.
trigger.
Okay. Because that's the key right there. Because I think, I like to have a glass of wine with dinner.
Mm-hmm.
Is that's not a
No.
trigger? Because I cannot have a glass of wine with
Exactly.
dinner too, and as many
Exactly.
times I don't.
Yes.
Okay, got it.
Exactly. For cigarette smokers, it may be that I can't have a cup of coffee and not drink and not have a cigarette.
Oh, interesting.
That there are things that trigger us, and so we talk about people, places, and things
Okay.
that may trigger us
Okay.
to drink or use or do the behavior. So that's loss of control. Number 3 is the continuing to use in the face of adverse consequences. We look at adverse consequences as 5 areas of a person's life: health, job, finances, legal status, family, and relationships. So as we just gave the example, the doctor says, I'm concerned about your drinking. I think it's affecting your blood pressure, and your lab tests show your liver numbers are starting to go up. And this can be risky for you at your age. And so you get that medical advice of the possible adverse consequences, but you continue to drink.
Okay.
Or your boss says, another Monday morning coming in late like that and not getting your reports done on time, you're going to be written up for that and may lose your job. Or you get a DUI. Or
That's a wake-up call for a lot of people.
you would think
Or
that
getting-
it would be. You would
or it
think
can
that it
be,
would
right?
be. It can be.
It can be. Or if they got 2 or 3
Yes.
DUIs.
Yes. Fortunately, we get pretty good support from the legal community because your attorney may say, you've got to go before the judge in 6 weeks. I think you better get into treatment. But that's a real hallmark. Continuing to use, even though I put things I say are important to me in jeopardy.
Okay.
Then the 4th part is the tendency to relapse after being abstinent for a while. And that may be a matter of brain functioning, just because you decided to not drink or use anymore. The brain says, nobody asked us. And so it may be a biochemical process that causes the brain to relapse.
So there's a lot to address, and you're talking about behaviors, but also sometimes the substance is addictive, like cigarettes. We know that cigarettes,
Nicotine, absolutely.
it's addicting. I mean,
Yes.
if you're gonna smoke cigarettes, you're going to be addicted. I don't care what. But you could sometimes drink alcohol and not be an alcoholic, but then there's some people that can't.
Correct.
So it's complicated.
It is complicated, yes.
So tell us about the recovery program, the St. Helena Recovery Center.
St. Helena Recovery Center has been a part of St. Helena Hospital for over 30 years. And we're the little gold nugget tucked away up here in the wine country. And by the way, people say, well, how can you have an alcohol and chemical dependency treatment program in the middle of the wine country?
You have to.
Well,
Hello.
I say, well, people don't, our patients don't go out and suck on the grapes. So,
I see. Like if they go out, yeah.
but it's a really wonderfully serene setting
Yeah.
to kind of get the parts of your life back in shape. Essentially, we offer a wide range of services for those patients that are significantly ill from their use of chemicals. We are able to put them in the hospital for medically managed detox.
So important.
Okay. I don't believe in cold turkey. I think that's cruel and unusual
Don't do
punishment.
it, and it can be medically a problem, right?
Absolutely.
People can die from that even.
Exactly. So we do a very closely medically monitored detox so that people are as comfortable as possible and have the least withdrawal side effects. We use state-of-the-art medications for supportive detox. And then once the detox is satisfactorily underway, then we transfer the patients to our recovery center, the rehab portion of the program. And that can be up to 4 weeks in treatment. And we have a very strong multidisciplinary staff. I am the medical director. We have nurse practitioners, nursing support. We have well-trained and long-experienced counseling staff. And we have some line staff who are there as persons in recovery themselves to provide support and assistance to the patients while they're in treatment.
Well, this is important.
If patients need it, we have access to the mental health department and are able to provide psychiatric consultation if that's necessary. And of course, we have the backup of the whole hospital for medical problems that arise.
That's just wonderful, Dr. Hambrick, and I'm really glad that we're talking about this morning, because I think sometimes in the wine country we don't want to admit that there are people right here in our wine industry that have a problem.
Exactly.
And we don't want that to be swept under the rug, and we want people to know where they can get help.
Right.
So I'm really glad you're here, but please tell us how people can get more information.
Well, the two primary ways to get in touch with us, online, St. Helena Recovery Center.org,
Okay.
sthelena.recoverycenter.org, and our 800 number is 800-454-HOPE, H-O-P-E, 454-HOPE.
Well, thank you, Dr. Hambrick, for being with us this morning.
My pleasure.
That's the St. Helena Recovery Center, and that is Healthy Communities. Thank you, St. Helena Hospital.